All right, stop. So we've been assigned to airway team. If you can get a BBM, I'm going to place an OPA.
Copy that.
BBM. In. BBM, thank you.
Attaching it to 100% oxygen.
Oxygen.
15 liters a minute.
Getting decent compliance. Can we add the impedance threshold and end-tidal CO2, please?
Yes, sir. You ready?
Get that attached to the monitor.
Connected.
Great. Can we do some two-person bagging, please? How's the compliance feel?
Feels like good compliance.
Okay, cool. So just starting to check out the airway situation here. If we're going to move towards intubating, you going to be able to bag on your own for a moment?
Yes.
Actually, let's position him first. Can we add some blankets? I'll take one-person bagging, and then will you get some blankets ready to place under the shoulders and head? Okay. Let's put a few under the shoulders. Probably about right. Once more, can we get a few more under the head, please?
Is that like...
Let's put one more folded blanket like that under the head. That's great. Okay, can you take over the BBM? So on this airway assessment, looking externally, I don't see anything that's going to impede an intubation, make it particularly difficult. Can I zoom out really quick? On the 332, I can fit 3 fingers in the patient's mouth, 3 under the chin, and 3 down to the thyroid. And my fingers are pretty much the same size as this patient's, so that's good. Malin potty, with the patient unconscious, it's a little difficult to tell, but I don't see anything in the mouth that's going to impede an intubation attempt. We don't suspect any obstructions, but we're going to go in with suction, and there's plenty of neck mobility, no neck mobility issues. So I'm going to start preparing equipment for intubation. I'm going to use a Mac 3, the Lightworks. I think a 7/0 tube is going to be about the right size, similar size to the patient's pinky finger. Whew. Let's get a clean one. Bougie suction is on and working. Got a stethoscope, and we've got the tube tamer. Okay, so if you can bag one more time, what I'm going to do is go in with suction and laryngoscope, and I might use your hand to help manipulate the patient's trachea.
Got it.
One more bag there. If you'll try and stand on the right, that would be most convenient. Okay, so I see hard palate, soft palate, some suction, but a little bit of epiglottis, vallecula, more suction. It looks like I've got a grade 3 there without any help. Can you place your fingers on the cricothyroid cartilage? I'm going to use some backwards, upward, rightward pressure. And with that, I've now got a grade 1. A little more suction. Set that down. And we'll intubate with the bougie. Bougie past the cords. I feel tracheal rings, and it's all the way down to bronchial hang up. So if you'll thread the tube over the bougie. I've got the tube and it's past the cords at good depth. We are 20 at the teeth. You can go ahead and inflate the cuff and pull the bougie.
Cuff's inflated.
Great.
Bougie out.
Can you bag that for me, please? So, Stoff, I'm going to prep to intubate with the King Vision. I think 7.0 tube. It's going to be about the right size for this patient. About the same size as the pinky finger. Need a syringe and some lube to put on the tube. A little lube on the tip of the tube. And 10 cc syringe is on and the cuff is working. King Vision, turn it on, got the channel blade. We'll set the tube up with the tip of the tube right there at the end of the channel on the King Vision blade. Got suction, it's on and working. And tube holder and my stethoscope. All right, Stoff, if you'll bag 1 or 2 more times there for me, and then pull the OPA.
Last one. 6.
All right, open the patient's mouth. I've got the King Vision sideways so it's easier to insert. I see hard palate and soft palate, and then transitioning up to the video screen here, I see some epiglottis, and I'm in the vallecula, so some gentle pressure back, and I've got grade 2, almost a grade 1 view of the cords. We'll advance the tube and watch it past the cords to the proper depth. Stoff, you can go ahead and inflate the cuff there for me, please.
Inflated.
Great, and then go ahead and bag. How's the compliance feel?
Compliance is good.
Looks like we've got chest rise, our bilateral lung sounds, and nothing on the epigastrum. So we'll go ahead and secure the tube. Clamp it down. Great, thank you.